Welcome to We Question and Learn. We're celebrating our 17th year with different guests from in and around the Northwest Pennsylvania and sometimes beyond. We are now on NPR1, distributed there, and also on about 6 other podcast venues, so our reach goes out pretty far. Today, we have the honor and privilege, I hope I can call you an old friend, not meaning that you're aged, Charles Boo Hagerty. He is the Chief Development Officer of the Hamot Health Foundation. How long have you been doing that now? It seems quite a long time.
So, Tom, first of all, thanks. Great to be here with you today. And the answer is I've been at Hamot 20 years, but my career with Hamot spans now 30 years. So when you think about my 10 years in the ad agency with Hamot as my client, so quite a while with the organization. So yes, we can call ourselves old friends.
I was going to say they finally gave you an office, but
yeah, exactly. Exactly.
Well, that's sort of a joke in one way, in that you don't sit around too much. Your duties go far and afield. You are the Vice President of Marketing and Corporate Communications, and in the 21st century here, that's probably taken on a whole new realm. And I'm referring to not only the old traditional ways that you and I remember, i.e. the typewriter and the postage stamp, but going into the 21st century, have things changed much, or is it just the media that's changed?
No, things have changed dramatically, for sure. You know, when you talk about my time at Hamot, I've done a number of different roles, specifically at the foundation, about 8 years, actually 10 years now overseeing that part of it. But, part of my time at Hamot definitely was marketing. I have to say that there's people a lot smarter and a lot younger than me who are taking it to a whole nother level, because we definitely have changed the way we communicate with people. And I don't want that to be mistaken for traditional forms like this aren't important, because they're vitally important. I love podcasts. I love different ways to communicate with the community, for sure. But yeah, it's changed dramatically, and it's generational, for sure. I'm not a huge social media guy, but a lot of people are getting their information on social media. I worry about misinformation, yes. But at the same time, information is information, and people can process it in ways that they probably didn't process it before. I think the consumer is smarter. Mm-hmm. I definitely think the healthcare consumer is smarter, and I actually think that's a good thing. So,
well, I don't want to give up the radio part. My fingernails are in the rug, even though with the COVID scenario, I'm sitting in the luxury of my at-home upstairs studio, which we all have now, right? Boo, you probably communicate with quite a few of your donors and members via Zoom, I'm guessing, right?
Absolutely. We're doing a lot of Zoom. I'm at home right now as well. That being said, no. I think the beauty of this is radio is not going away. It's very much a very important medium, and every one of us uses it to our advantage, for sure. So I'm glad to be with you today.
Well, a challenge in the 21st century is fundraising, but you're well aware of all the challenges, I'm sure, having been in that position for quite a while now. As the Chief Development Officer of the Hamot Health Foundation, what are your duties as assigned, as they say?
So I would say in a sentence, we are to drive healthcare change. That's what we are trying to do at the Hamot Health Foundation, is really drive new and innovative ways for people to access healthcare. And we're able to do that. And when you talk about the fundraising side, fundraising doesn't have to be difficult if you put the right projects in front of people that they are passionate about. So my biggest challenge, I would say, Tom, and COVID just screamed the inequities, right? But 2020 has been a year where we've really seen firsthand the inequities of the distribution of healthcare, and we want to change that, and in many different forms. We want everyone to have access to a physician, regardless of their zip code, regardless of their address, regardless of their race, ethnicity, gender. We want everybody to have access to healthcare, and we don't have an equitable access of healthcare. So we're driving things like putting doctors' offices in neighborhoods that haven't had doctors' offices in the past. We believe that we need to drive education, not just for our employees at the hospital who need to advance their knowledge and advance their careers. That's very important to us. But for members of our community who don't see themselves as healthcare workers, we are in the process right now of being the major force behind the renovation of Wayne School. Inside Wayne School at 6th and East Avenue, this spring, we will see a rebirth of that school. And then the first floor will be the Erie Center for Arts and Technology. It's a arts and technological program for students and high school graduates who need a little something extra, need a little boost. And inside ECAT, we'll have programs that are mentoring high school students, but we'll have programs that are teaching a trade at no cost to the student. We'll do medical assistant training. We're looking at insurance coding. We're looking at some other things. We're working with the trades right now. So I'm the board chair of that, and our foundation is a major investor in ECAT. The second floor of that building will be the United Way of Erie County, which they're moving their corporate offices into Wayne School. But also on the second floor is Primary Health Network, which is a federally qualified health center. It's in the basement of that building. It'll be moving up to the second floor, doubling their square footage, adding practitioners, and taking care of the healthcare needs of that neighborhood. And then the third floor, probably one of the things that I'm most proud of that we were able to get accomplished this year is we're starting a school of nursing. And it's an RN program. It's going to be called the UPMC Jameson School of Nursing at UPMC Hamot. And inside that will be 58 students starting an RN program. And they're probably that non-traditional nursing student. It's someone who sees themselves as a nurse, but maybe doesn't see themselves at a 4-year college. So we're going to be able to put them in this hospital-trained nursing program, and 2 terms a year we'll have a class. So by a year from now, we'll have well over 120 RN students who will provide and help with the nursing shortage in this community. So that's a big project we're working on. That Wayne School is a mouthful, but every floor of that building, every tenant in that building, we are helping at the foundation to drive the funding to make that happen.
That's fabulous, because something ends up getting bulldozed down, and you've taken it 180 degrees and created not one, but a whole group of, a place for community organizations to help serve. Plus the fact you'll be there as well.
What's great is it gives a neighborhood hope.
Yes.
And we're very excited about being a major part of that. So that's just one thing we're doing this year. That one project. There's many facets inside that project, but that's just one thing we're doing in 2020. We're supporting the build of a brand new patient care tower at Hamot that has opened this winter, and As
we're recording this, we can say the opening is today. So you probably have to run downstairs or run over to the office and celebrate that.
Which is no problem. I'm happy to be with you for sure.
No, it's great. I want you to frame the building and the resource it brings, the service it brings to the community. All I saw was at first a big hole, and now I've seen the building. Can you just describe that facility for folks who don't get downtown, or for folks who are out of town right now?
Sure. The last place we want any of your listeners to be is in an ICU in a hospital. But inevitably, ourselves, our loved ones, our family members, our friends end up in an ICU after major cardiac surgery, after a trauma, after some neurological problems, strokes, whatnot, medical intensive care. All of our intensive care units in the hospital, Tom, over the years have been spread out on multiple floors. And certainly the care isn't as much about the facility as the people, but the facility is not unimportant. We are now able to, starting, right now, we will move our clinicians over to this new building. And on 2 floors, we'll have 64 brand new ICUs. Inside these ICU rooms, they're 100% private rooms. They have their own bathroom, which makes you think, well, they should. Well, a lot of ICU rooms do not. They have their own bathroom, a couch for a loved one to stay. Every room has a window with natural light coming in. We don't have that now. But beyond all that, the medical technology we're able to put in there is second to none. If a patient has to be dialyzed, we don't have to move them out to the dialysis unit. We can do it right in the room. You could probably, it's equipped enough if you had to do a procedure, not move the patient, you could do a procedure in that room. So the intensive care units are completely brand new at Hamot as of today. And that's a huge impact. This is 10 years that we've affiliated with UPMC. And I would say this is the last renovation of the hospital. Every room inside our hospital in the last 10 years has been renovated in one way, shape, or form. And this is the final piece of it. And we're very, very excited about being able to deliver the highest quality care, patient satisfaction foremost, but also in a facility that you're not going to see anything like it in the country.
You folks have done excellent work getting the money together to do that, let alone building a fantastic and state-of-the-art 21st century facility. Let's talk about your job. If I took one folder for every foundation or fund that supports you, I wouldn't have, it wouldn't fit on the desk in this room by far. The folders would be falling on the floor. So you have many, many, many endowments. Those have been developed over the years. Am I correct?
Yeah.
Yep. Right.
Yeah. We have some going back to 60, 70 years ago. 140 years on July 1st will be the anniversary of Hamot. And Charles Hamot Strong and his wife and his sisters founded the hospital. They donated their home to the community to be a hospital in the name of their grandfather. And at that moment, fundraising began. The hospital started on philanthropy, and there was 40 people in the community who were what's called the Hamot Board of Corporators. And those 40 people were the ambassadors to the hospital. They appointed the board, but they are also fundraisers, and they also donated to the hospital. And a nursing school started at the hospital in the 1890s, all through philanthropy. A volunteer organization, which is now the Hamot Aid Society, started on philanthropy, and the job was to support, all the equipment, all the technology that you're putting in the hospital. 140 years later, we're still doing the same thing. And we have about 140 funds that are, temporarily or permanently endowed that support our hospital. And that grows. I mean, certainly we're adding to that, hopefully every day, but not quite every day. You know how that goes.
Yeah.
But we have a tremendous amount of support from that board of corporators, which is now 350 people strong. Our board of corporators adopts a project every year, and we've fundraised with them every year to ask them to support a project. And those projects have been many over the years. This year, they're supporting scholarships for our School of Nursing. Last year they supported our research initiative where we launched McGee Women's Research Institute, which we can talk about a little bit. But over the years, they've funded, upgrades in our radiology department, upgrades in our emergency department, upgrades in our operating rooms. They've funded scholarship programs in the past. So these corporators have been fantastic. And whatever project we say has the highest need at the hospital, they go with it. And it's a board-driven process. We have corporator officers, and they guide our foundation board in terms of what they see as the priorities for the community. And there are eyes and ears out there. And that model is 140 years old, stands the test of time. But make no mistake about it. As much as the Hamot Health Foundation supports this hospital, supports this community, we're really proud of that. 10 years ago, we affiliated with UPMC, Tom.
Well, now you took my next question, but that's quite all right. I just want to let folks know we're talking with Charles Boo Hagerty, so if they're tuning in, they're catching this. He is the Chief Development Officer of the Hamot Health Foundation here on WQLN. Now, I didn't mean to interrupt you because you're making a very important point. Go right ahead.
Well, and 10 years ago when we affiliated with UPMC, it was really quite a monumental feat for the community, for the healthcare of the community, in as much as that UPMC guaranteed $300 million in capital investment in UPMC Hamot. And as I told you, we've rebuilt that hospital inside out in the last 10 years under great leadership, by the way. David Gibbons, our president, and Jim Fiorendo prior to David. Fabulous men who have done a great job with a second to none medical staff, second to none nursing staff, second to none administrative team. I'm just really proud of my coworkers who I get to work with every day. But UPMC promised, guaranteed $300 million. I always said there wasn't a hospital president in the country who could hold up a piece of paper and say, in the next 10 years, I'm guaranteed to spend $300 million. That's if I don't make a penny, Make no mistake, we have margins we have to hit. But for the, $300 million guaranteed. When the towers ribbon is cut today, Tom, it'll be over $400 million in investment.
Wow. In this community.
In Erie, PA.
And that's not counting payroll, utilities, all the infrastructure, the spinoff,
that's just
people delivering, bringing things to you. I mean, that's a spider web that encompasses all the way back down to Pittsburgh.
Yeah. It costs $2 million a day to run the hospital. And that's
could you repeat that? My ears just burned a little. I mean, in a good way, because that means excellent service. A day?
It's about $2 million a day to run.
$2 million a day. Wow.
Yeah. By the time you have salaries and technology, and everything, and it's it's an impressive number because we're 3,500 people strong with well-paid jobs and taking care of their families and members of our community, and certainly we're proud of that. We're one of the largest employers in Erie County, and we're proud of that. People in healthcare this year, especially, are heroes. And it's something that we've known all along, but it's something that the country really got to start to understand maybe a little bit more this year.
Yeah. How is this? Boy, I almost asked you a very dumb question, but maybe it isn't. How is this affecting you?
No, it's not a dumb question at all. I think it's a really good question.
Okay. How is this? How is it all working out?
I will tell you that we are better and smarter today than we were a year ago. Great. That being said, it's been emotional. I would, I don't want to speak for my coworkers and my colleagues. I'm fortunate enough that as an administrator of the hospital, I get to round a lot, and I get to talk to the employees and just thank them for the job well done, but let them vent a little bit. What's on their mind? What are the questions? These are people who are taking care of very sick people and then worried about going home and bringing COVID into their home, or and COVID was such an unknown in March. We have a little bit better grip on it now in terms of how to deal with it. But it has affected people personally and emotionally in many different ways, but it has not stopped a person from giving the highest quality care to their patient, but I would say, Tom, the intangible, the thing that you really couldn't think about or plan on, we had to, for many, many reasons, limit our visitations, right?
Oh, yes, of course. You don't think about that immediately.
You don't think about it immediately. It's one of those things that, makes sense. You can't have the entire, it used to be the hospital was an open door all day long. And it would not be unusual for a patient to have 5-6 family members in their room at a time, right?
Yes.
Because you didn't want to take that away from them. So visiting hours were all hours of the day, and there was no limits as to how many people could be in the room. And as important as that is for the patient, sometimes that was cumbersome for the caregiver. You want to come in and have a conversation with the patient, you want to check vitals, and you're wading through a sea of people to make that happen. Fine. You dealt with all that. Now you flip to no visitors for a while, and then one visitor for a while, but one visitor for 15 minutes, so the patient was very much alone in the hospital. That's what took the toll on our employees, because now all of a sudden they realized, I have to be the one holding their hand when they get some bad news. I have to be the one holding their hand, sadly, when they expire. And we had a lot of that. And that took an emotional toll on our employees. Between Christmas and New Year's, we had a lot of people who passed away, and none of them were alone, because our employees would, after their shift, punch out and say, I'm staying, and I'm going to sit here with this patient and hold their hand until they close their eyes for good. And they would sometimes be on FaceTime or Zoom with the family member, very emotional, very hard. And I tell you, the thing that blew me away this year, and I don't mean to get overly,
No, it's good. It's good.
deep here.
No, go ahead.
We brought in therapy dogs over the years for our patients. Well, in the last month, we're bringing them in for our employees.
Oh, fabulous! Yeah.
These therapy dogs United, run by Bonnie Tercia. She's been a godsend to us.
Yeah.
They have done a great job of helping the caregiver. You forget about how hard it is, how emotional it is for that caregiver to take care of really sick people and inevitably, in some cases, lose those patients. That takes a toll. So I would say that's been the one thing that has really been different, right? For lack of a better term. But again, we've learned a lot. It's making us better. We're going to come out of this much stronger than we ever were, much smarter than we ever were.
Well, I think Northwest Pennsylvania and even beyond, because I'm sure you have folks sneaking over the border, so to speak, and all for good cause and to have good outcome. The community is better not only financially, but physically because of the health care you provide, but emotionally now. The community, I would hope, all they got to do is drive around the block where you are. They would feel better that there's a place they know they can go.
Absolutely. Yeah. One of the things, and you touched on it a little bit with that comment, is we don't want people to feel like they have to leave the community for high quality healthcare.
Yes.
And I'm a numbers guy, right?
Yeah, no problem. That's great.
Look at data all the time.
Yeah.
We had a board meeting, a UPMC Hamot board meeting yesterday, and we call it out migration. How many people are leaving the Erie community to go to Cleveland, to go to Buffalo, to go to Pittsburgh for their care? And it was double digits, 10, 15% for years. One of the concerns that the community had would be if UPMC affiliates with Hamot, would more and more people be going to the Pittsburgh hospitals? Well, the reason UPMC affiliated with Hamot is to actually cut back on that. They were seeing too many people from Erie, and they wanted people getting care at home. So it was actually the reverse of what people thought it was going to be. And now I can happily tell you that number is down to about 4% of our patients.
I got to say, I don't see as many as those helicopters anymore, because those are used for emergency procedures.
The helicopters are bringing people to Hamot from the region, not taking people down to Pittsburgh. I mean, and I'm not saying that doesn't happen. There's a point in time where the care has to be elevated to a specialty that maybe we don't have here, which are very few specialties.
That happens everywhere in the country.
It happens everywhere. Yeah.
Where you have to bring the patient to that one physician who's so specialized that it's the only way to accomplish healthcare. Yeah.
We probably see about 10,000 more patients per year in 2020 than we did in 2010. That's a big increase. So we're able to take care of people at the highest level. And the other thing that's really important, Tom, is, we want the patient to have a great experience when they're there as well. So we've been very intentional about making sure the patient experience, and the patient experience isn't about being nice. Certainly that goes without saying. The patient experience is making sure that the patient feels informed, that all their questions are being answered. We hourly round on every patient, of course, when they're sleeping, but someone is in that room at least every hour saying, how's your pain? Are you hungry? Do you need to go to the bathroom? Do you need to get up and stretch? Do you need to be repositioned in bed? Every hour we do not let that patient have to hit that call bell, right? So we got to be so that's what we mean about the patient experience. And we work really hard to get that right.
Charles Boo Hagerty, Chief Development Officer, Hamot Health Foundation. Last couple of minutes here. You've done so much work. You've talked about all the renovation, the massive amount of new construction, the facilities, the design, the increase in healthcare by numbers and by profession. What's next in the next couple of years? Is there something, or are you just making sure everything runs exactly the way it should?
You want to break some news?
Yes, I would be thrilled.
Okay, let's do it. So we look really hard, Tom, at the social determinants of health, right?
Yes.
As great as this hospital is, we don't want people coming here. We want them home. We don't want people sick.
Oh my!
Right? And social determinants of health are many things, but basically, what are the barriers that people need to knock down to stay healthy? And we took the unhealthiest zip code in the city.
Mm-hmm.
Unhealthiest isn't a negative term. I don't want it to sound that way, but just
the greatest need. You determine the greatest need. Yeah.
Thank you, Tom. You should be on my side.
Anytime. I'm retired. I'm available for any part-time work.
the greatest need. So we found an area of town, and we went and talked to the neighbors. Our foundation worked with Erie Insurance in the city of Erie, and Primary Health Network and UPMC for You, which is the Medicaid side of our health plan.
Mm-hmm.
And we put some money together, and we hired people in the community. It's called the Count Me In Initiative. And we knocked on doors,
mm-hmm.
and we talked to 800 people. And we said, what are the things getting in the way of your health, right?
Mm.
Access to a physician, a good paying job,
mm-hmm.
and
mm-hmm.
better housing.
Yes.
So we're taking care of access to a physician by putting physicians' offices in their neighborhoods. A lot of work to do there, but that's what we're doing. The second is education. We're starting a school of nursing. We've started this Erie Center of Arts and Technology where we can get training to people at no cost to them, and they can go into a family sustaining wage job, right? Because training is important. And then housing. Well, what do you do about that? Well, we're going to start to partner with like-minded organizations and invest in housing. And by doing so,
that's phenomenal.
Yeah, the environment means everything.
Yes.
What's the air you're breathing? What's or is it cool enough in the summertime, warm enough in the wintertime? But with some of these places that some folks are living in, at no fault of theirs, it's all they can afford. It's broken windows. It's no ventilation. It's no air conditioning. The heat doesn't work in the winter, and it's not the right environment for people to stay healthy. Period. We have to create that. So that's our next thing. So there's no rest. We have much work to do.
Nothing stops. Unfortunately, something has to stop here, and this is the dilemma of broadcast, these little 30-minute spigots we have. And I want to thank you heartily, Charles Boo Hagerty, Chief Development Officer of the Hamot Health Foundation, because I did learn something today. And thank you for the outlook into the years upcoming as to what UPMC Hamot will be doing in the community. So please accept my thanks today.
Thank you, Tom. I appreciate you very much and being part of this. And I'm always willing to come back and talk to you. You know that. Anytime you need me, I love talking about this great stuff in this great community.
Well, you have a guaranteed spot. Thank you again.
Here's today's edition of Health in a Heartbeat. Go ahead, pile on the chili peppers, if you can tolerate them. It just might help your heart stay healthy. Findings by researchers in Italy suggest that regular consumption of chili peppers may reduce the long-term risk of death from cardiovascular disease. The research team followed the health habits and outcomes of more than 28,000 people from southern Italy from 2005 to 2010. About one-third of the study's participants said they rarely or never ate chili peppers, while about one-fourth said they ate them often, at least 4 times a week. Compared with those who didn't indulge in chili peppers or did so infrequently, the chili pepper aficionados had a lower overall risk of death from all causes, as well as from heart disease, cardiovascular ailments, and brain issues. Chili pepper consumption appeared to have the greatest reductions in death from ischemic heart disease and cerebrovascular disease in which blood flow to the brain is somehow compromised. Eating chili peppers also seemed to lessen some effects of an otherwise bad diet. And those who followed a healthy Mediterranean diet, more fish, fruits, and veggies, less red meat and sugar, as well as those who ate less healthy foods, got protective effects from the chili peppers. Researchers say there's more work to be done. In particular, they want to determine whether chili peppers can amplify the health benefits of a Mediterranean diet. In other words, merely adding chili peppers to an otherwise poor diet may not be a magic bullet for better health. But the research suggests that chowing down on chili peppers can do your heart some good. That is, if you can stand the heat. Health in a Heartbeat is produced by University of Florida Health, committed to advancing excellence in patient care, research, and education, and by WUFT-FM. Our medical advisors include University of Florida College of Medicine faculty members who provide the latest information in health research and patient care. Visit us at heartbeatradio.org.
Welcome to We Question and Learn. This is Tom Pysz. We're celebrating our 17th year here on the air on WQLN Radio. Hard to believe 2021 snuck up on us. We're going to stay close to home today. By the way, this program is heard on WQLN Radio the first Sunday of the month at 4, so you hear that. But this program also is on NPR One and about a half dozen other podcast venues. With us today is Tom McClure, and you're the district manager of the Erie County Conservation District. Good day. Hey, ECCD, is that how you folks name yourselves?
Yes, it cuts down on writing all of that out, Erie County Conservation District, so sometimes we just shorten that up to ECCD.
Where are your offices?
So our office is located on Wager Road in Mill Creek Township, so that's right off of Route 8, I-90,
okay.
Up on that end of Mill Creek Township.
And your facilities, what do they look like?
So we have a two-story office building. We're back in the Bundy Industrial Park. So we have an office building and nature center facility here, and we're connected to a larger property that we call Headwaters Park, a public access park, outdoor recreation area with hiking trails and things like that.
No offense, I think that's somewhat of you don't want it to be a secret. Let's do some PR on that. How long has that been there?
Well, it's been around, this office facility was built in 2003. Okay. We used to be located in Waterford, but this building was built in 2003. Prior to that, in the late 90s, so like 1995, 96, the early stages of the park began. So we have been in this area for some time. But yeah, we try to get the word out that there is another park for people to enjoy, bring their families out, do a small hike. We've got about 2.5 miles of trails currently, and just this last year, we completed construction on a trail expansion project. We got a nice grant through the state, we call it DCNR, the Department of Conservation and Natural Resources. And with help from them and the County of Erie, we were able to put in about 1,200 feet of new trail, which includes a beautiful boardwalk area that extends out into this wetland area of the park, an area that we didn't really have access to before, but we do now.
That's fabulous. Is it open in winter?
It is open in winter. Now, we don't do any trail maintenance during the winter months, but
Sure.
That would be great for anyone who is into cross-country skiing or snowshoeing if we do get some snow accumulation. But on a day like today, trails are open and might be a little slippery in spots, but we're open year-round and from dawn to dusk every day.
That's fabulous. We're talking to Tom McClure, District Manager of the Erie County Conservation District on We Question and Learn today. You folks are just not into that area as maintenance. You have a good deal, a large number of responsibilities. And if you could you outline what your main duties are as an organization in this community?
Sure. Sure, absolutely. Just a bit of a background. What a conservation district is. Conservation districts go back to the 1930s. If we remember our history books with the Dust Bowl from the Midwest, that event was really the genesis for the conservation movement in the United States, and how to cooperate with government and landowners and farmers, how to conserve our soil resource and our water resource. And in fact, conservation districts exist around the country. Sometimes they're known as soil and water conservation districts. Here in the Commonwealth, we're just known as conservation districts. And we here in Erie County, we are one of 66 conservation districts in Pennsylvania. And really, our main duties center around erosion and what we call sediment loss, or we're talking about the soil loss, issues like that occur within our county borders. So we like to see the soil remain on the ground and where it's at, and not into our streams, because in Pennsylvania, sediment or dirt or soil, whatever we want to call it, when that enters a stream, it is a pollutant and can cause harm to our wildlife and our ecosystems.
How many folks work in your organization?
So right now we have, including myself, we have 8 staff here that work in different programs. We have some technicians that deal with. We talk about earth moving, construction activities in the county. Those environmental permits come through our office, and so we need to review those, make sure everything's up to snuff, and we can approve those permits. We work with the Department of Environmental Protection in Meadville, known as the DEP, and so we partner with them on getting these permits through our office and out the door, so people can start their projects.
Now, under your categories, one is, I believe, agriculture. How do you interface with folks in that industry?
So really, like I said before, conservation districts were started by farmers, and that was the case here in Erie County. Our organization started back in 1949. A group of concerned farmers who wanted to preserve and conserve their lands started the district. So when we work with farmers, our main concern is, at least with the livestock operations, we want to see farmers keep the manure in place and not in our streams. And so we can offer technical assistance to those folks, work with them on what's called manure management or nutrient management. Those are some buzzwords in our industry, and help them have better barnyards. And through grants, we can even offer some financial assistance to install some construction projects on their properties to help facilitate that control of manure and fertilizers and things like that.
You have quite a few projects. I'm amazed as you go to the website, which is erieconservation.com. I would encourage people to click under featured projects. You folks, forgive the liner here, you do not let the grass grow under your feet. Conservation extends into quite a few areas, as I noticed here. And some of these are trail development. Some of these are, wow, you even have a drip rain barrel project, just to mention one. But are all these projects managed by you and your staff?
The ones featured on our website are, yes, but we can't go it alone. Like I said, we have a staff of 8. So we do rely on partners to get some of these projects done. And, some of the projects that we've done over the years, putting conservation on the ground, we did a stream rehabilitation project through Frontier Park and Cascade Creek. So that took a lot of partnerships to accomplish. We've done some other farm projects in the Northeast area, Northeast Township. It's a grape growing region over there, and we work with our vineyard owners through a program called Pennsylvania Vines, and Vines standing for Vested in Environmental Sustainability. And so we're enrolling our grape growers in this program to install what we call best management practices, another buzzword in our industry, to control runoff, proper drainage on farms, keep the fertilizer and those chemicals like nitrogen and phosphorus on the farm and not in our streams. Because eventually, being in the Lake Erie watershed, those what we call nutrients make their way to Lake Erie, and those nutrients are food for those hazardous algae blooms we hear on the news a lot.
That is a big issue.
That is a big issue.
Now, your area is Lake Erie, obviously, but even as you go as far east as Chautauqua Lake, this is a serious issue in the United States today. Am I right?
Right. It is. Yeah. You look at areas where there's a lot of agriculture. Those nutrients find their way into our waterways and can do some harm. So we try to reduce the amount of loading of those chemicals and the sediment itself through projects, and we can do that in a sustainable way. And again, it takes partnerships with landowners to accomplish those things.
Forgive a second pun. You do a lot of seed planting in another way. You are involved with children and education, middle school and higher, on all sorts of fronts. You folks do an incredible amount of work in that area. Tell us a little bit about some of the programs that come to mind.
Sure. We have a pretty robust environmental education program here. We have a staff person that it's their job to educate the public when it comes to environmental issues. And so pre-COVID, we would have schools from the county and the city make field trips here. We take them out into Headwaters Park, get them accustomed to nature itself. The stream Mill Creek runs right through our park here, and so we do different environmental and educational activities with the stream, teaching the kids different aspects of how nature relates to our water, and a lot of water programming comes through our organization, and at least getting kids introduced to the outdoors. We had an after-school program through in conjunction with the City of Erie School District. We called it Nature Immersion, and gets kids acquainted with the outdoors through an after-school program.
What's your budget like? The main source of the budget would be the state, am I right?
Right. We are funded through different means. The state provides funds for us and for conservation districts around the state. And we're also funded in part by the County of Erie. We receive a community grant each year, or we apply for one each year, and we're very thankful that we have county support here as well. Talking about our environmental education program, there's always not a lot of funding for that, so we do have to do a bit of fundraising for that program. and we accomplish that in part, through grants, and then also we offer an annual seedling sale or a tree sale that helps us promote some of that education effort.
What's your budget like? How do you manage all this?
So I think, we talk about, with all the programs and funding that we receive, we get about $1 million each year. And a lot of that is, restricted program funds. One of our bigger programs that we operate through our office is called the Dirt and Gravel Low Volume Roads Program. Mm-hmm. It's where we assist municipalities in the county for environmentally sensitive road maintenance projects. And so we can offer funds. Basically, they come into our office. We offer them out to municipalities who apply for those grants. And so we put the money on the ground as much as we can through projects.
Your budget is under review every year. You have to apply for grants. You're hand to mouth quite a bit. I get the feeling that
we are.
It's sometimes stressful.
It can be at times, and with this year especially, we were hand to mouth through November, and then the state legislature extended that state budget through the end of June here this year. And so it is a battle, to get these state funds, local funds. But I see it as always the conservation districts having them in your county is a benefit. Otherwise, we talk about permitting and economic development and construction projects. Those permits would have to go through the DEP, either in the region office or in Harrisburg, which could take some extra time. Mm-hmm. So I think, with a staff of 8, we are a little bit more nimble and can turn things around a little bit quicker than they would in Harrisburg.
We're talking with Tom McClure, the district manager of the Erie County Conservation District. Talk a little bit, if you would, about your board. Are they a governance board? Are they a guidance board? Do they help you integrate with the county? What type of board do you have? I guess that's an open-ended question more than it sounds, but your board is a highly active board, I believe?
Yes, we have a great board. There's a law surrounding about talking about conservation district. There's conservation district law in Pennsylvania, and that requires us to have 7 members. Mm-hmm. 4 of those members are to be agricultural related, so farmers. Mm-hmm. There's a large ag presence on our board, mm-hmm. and so these are volunteer folks. That care about the programs that we offer. We also have on our board what we call public directors. So that's basically defined as someone who's a non-farmer interested in conservation efforts. And then the 7th member is a legislative member of the board. And so that's the link between our organization and county government. And so the county executive sits as a member of our board as that link. So county always knows what we're up to and what we're doing, and it just solidifies that partnership that we have with the county and county departments.
So you have your farm director, your public director, you have associate directors, the county executive, the DEP representative sits on your board. Of course, every board has a good treasurer and a good chairman. So you've got quite a few people. How often do they meet?
We meet monthly.
Oh, yeah, that's incredible. That's great.
Yeah, we meet on the 3rd Thursday of the month. We do offer some in-person meetings, and also we offer that out as a virtual type Zoom conference mm-hmm. as well, and so those those meetings are posted on our website. We do our annual meeting notification, so the public is aware and able to attend if they can.
Is this a fundraiser on your website? It's called Order Seedlings. How did that all come about? Is that a fundraiser, or is that a conservation program, or was it a conservation, or is it a little bit of both?
I would agree that it's a little bit of both.
Okay.
So our annual seedling sale takes place at the end of April, and this year it's April 30th.
Good.
So this has been going on for now 40 years. And it's a program that a lot of conservation districts adopt. It's a way to get trees in the ground, and we can take proceeds from that sale and apply it to our environmental education programming. So what will happen here in the next month? We'll have an order form published and sent out to folks on our mailing list, or then we post that on our website, and you can take a look at that, print it out for yourself, and either order online through the online store, or you can mail your order form and payment in to the district here, and we'll get that processed.
That's an event, or I should say a program that benefits everyone in the community, one way or the other, especially over the long run.
Yeah, we see some financial benefit through in which we apply to our programming, and then the other benefit is that we get 3,000 or 4,000 plants in the ground through our customers.
That's phenomenal. Speaking of planning, your whole board gets together, your whole staff gets together. How do you determine, and of course you're probably involved with the state on this, how do you determine what you're going to do in the next, say, 1 or 2 years, or even farther out than that?
Mm-hmm. So we try to get together every 5 years and review our strategic plan.
Okay.
And so, yes, there is a lot of planning involved. We lay out our goals, our long-term goals, our short-term goals, our annual goals, and it does take a lot too. It takes a lot of staff input, it takes a lot of board input, and it takes a lot of, our partner or volunteer input from the community to provide direction for us. And so we try to do that exercise every 5 years and review those annually to make sure we're heading in the right direction.
One of your resources is the Regional Science Consortium, which
one of our great partners. Yes.
Yeah, nonprofit. Are they still up at the Tom Ridge Center?
Yes, they are.
They are, and I've been there. And as part of the Tom Ridge Center, they had a little lab going there and some nice offices. Mm-hmm. Unfortunately, we're sort of under quarantine here, but you need to have data and information in order to do programs, and they do quite a few research projects, I believe. And they also do education, I believe. Is that right?
A lot of both. Yeah. A lot of both. They're a great resource. We're glad to be in touch with them. There's a lot of give and take on. It's a two-way street when you talk about partnerships, especially with an organization like that. They need us, that we need them to roll out a lot of these educational programs. We lean on them for data when we talk about, our hazardous algae bloom issues that we have in the county and on Presque Isle and Lake Erie in general. We assist where we can with a partner like the Regional Science Consortium, and it's a good two-way street there.
And they have over a dozen very important organizations all tied in with them. So that's the big outreach. So you folks are, if I could say this, are all coordinated? You seem to be all working together.
At least we try to. Yes, we have the same vision, and we all are good at our own special talents. And then when we put those together, we can accomplish great things.
In the last few minutes here, you mentioned you do a 5-year plan, or every 5 years you get together and determine your mission, vision, etc.
Right.
Is that meeting coming up, or are you a little ways off? I guess the big question is, where do you see your organization going in the next few years? Or is it, let's just make sure we do everything we do now as well as we can and do it correctly?
There's a lot of fine-tuning that we can do. But main goals would be, or changes in direction would be to get more what I call putting conservation on the ground. And that's through projects. And so we'd like to see more projects that do what they're intended to do. Keep the soil on the land, keep the nutrients out of the water, and so with that gives the public a good visual of what we do. And so I'd like to see a lot more projects being placed on the ground, and that takes grant money, that takes cooperation and partnerships. And I'd also like to see, with our expansion of not only our trail network here at the park, expansion of our environmental education program. We've got a lot of resources here in this building. I'd like to get that out and share that with the public with more through more nature type programs.
Well, this is the part where we ask you to let people know how they can find you, maybe drop a notice to what your next project is, phone number, website. How can someone, being inspired by your comments today, how can people help you?
Well, you can always pick up the phone.
Yeah.
Our phone number here at the district is 814-825-6403. You can always find us online at www.erieconservation.com.
Excellent.
And you can always send an email to info@erieconservation.com.
Well, that's an
get a response there.
Easy name to remember, erieconservation.com.
Right.
They'll find everything they need to know, and maybe they can pop on the site and review some of the topics that you covered. What a great honor to have you here, Tom McClure, the district manager, and we
really appreciate you having
Oh my gosh, it's I think it's you're not a best kept secret, but a little PR relative to the investment that your organization is helping the community make in keeping us green, keeping us healthy in the long run. And the Erie County Conservation District, I believe, is a good investment. And if people would just like to learn more, they know how to find you. Go to erieconservation.com. I think they'll be not surprised, but they'll be gratified to see all your projects, all your outreach, to look at your board, to see your relationship with many of the major conservation entities in the community, and of course, folks that live and work here and depend on our environment to make a living.
Very good.
Hey, thank you.
Great.
You can hire me now as your PR guy. I'm kidding. I'm teasing. Because I know you have some well-grounded and highly educated and totally motivated staff. Tom McClure, thank you for joining us on We Question and Learn today. Thank you.
Thanks for having me.